pregnancy tests became widely available in 1978. At that time they were not more than 80% accurate, and the result had to wait 2 hours. Today they determine the fact of conception in express mode with a probability of over 90%. To do this, you need to put the indicator in your urine. If there are traces of HCG hormone, you will get 2 strips. But in the past, things were a little more complicated. What tricks were resorted to determine pregnancy in the past? The portal mental floss tells. 1. Wheat and barley. In ancient Egypt, around 1350 BC, women were advised to urinate on wheat and barley seeds for several days. If wheat sprouted, it would be a girl; if barley sprouted, it would be a boy. If nothing sprouted, then there was no pregnancy. Interestingly, this test does work, albeit partially. In 1963, researchers found that in 70% of cases, pregnant women's urine does cause seeds to germinate. 2. The smell of onions. The ancient Greeks used a different method. They suggested that a woman put an onion or garlic in her vagina before going to bed. If she had bad breath the next morning, pregnancy was out of the question. The medics of the time believed that an empty uterus contributed to the transmission of odor from the genitals all the way to the mouth. Conversely, having a baby in the womb kept the vegetable aroma from rising above the belly. 3. A trace of the deadbolt. Another analog of the modern pregnancy test is described in the 15th century folk belief book The Spinner's Gospel. The test subject urinated in a basin, and then a lock or key, but better a bolt, was dipped into it. The object was left in the basin for 2 to 3 hours. Then the urine was poured out. If the bolt left a trace at the bottom of the basin, then the test was positive. For wine and urine. Intuitively, people have long understood that pregnancy somehow affects the composition of urine. In the 16th century, urine experts mixed it with wine and used their observations of this cocktail to draw conclusions about whether conception had occurred. This method was not without logic, for alcohol could react to certain proteins in pregnant women's urine. 5. Eyes. In the 16th century, French physician Jacques Guillemot, author of an influential treatise on ophthalmology, claimed that pregnancy could be deduced from a woman's eyes. He wrote that as early as the 2nd month after conception, expectant mothers were distinguished by deep-set eyes with small pupils, drooping eyelids and swollen veins in the corners. He was generally wrong, but today's doctors admit that pregnancy can indeed affect vision, so they do not recommend getting glasses or contact lenses before you give birth. 6. Chadwick's sign. Approximately 6 to 8 weeks after conception, the cervix, labia and vagina may turn a dark blue or purplish-red hue due to increased blood flow to the area. It was first noticed in 1836, and 50 years later, obstetrician James Reed Chadwick reported it at a meeting of the American Gynecological Society. The discovery was called the Chadwick sign. However, doctors of the 19th century rarely used this indicator because of the puritanical mores that prevailed at the time. 7. Rabbit test. In the 1920s, German scientists Selmar Eskeem and Bernhard Sundeck determined that a special hormone was present in the urine of pregnant women. Today it is known as human chorionic gonadotropin, HCG. They found this out by injecting the urine of pregnant women into immature rabbits, rats, and mice. In most cases, the animal's ovaries increased in size. Although the phrase "the rabbit died" usually meant that the woman was pregnant, in fact all of the test animals died because they had to be opened up for examination. 8. Frog test. In the late 1940s, scientists discovered that when a pregnant woman's urine was injected into a live toad or frog, the unfortunate amphibian would lay eggs within 24 hours. In this case, the test animals, unlike rabbits, even survived to the next test.